Hello and welcome to a Health Podyssey. I'm your host, Alan Weil. If you've ever registered a child for school, you know that part of the process is showing proof that the child has been vaccinated against certain preventable diseases. These school entry vaccine requirements are adopted by states, which rely heavily upon the recommendations of the Federal Advisory Committee on Immunization Practices, or ACIP. Now, ACIP conducts a thorough evidence review of each vaccine, but that doesn't automatically translate into a school entry requirement. In fact, states can wait many years after an ACIP recommendation to adopt the requirement. So, how long does it take for states to act on ACIP recommendations, and why does it take some states longer than others? That's the topic of today's episode of A Health Podyssey. I'm here with Richard Hughes IV, a partner at Epstein, Becker & Green and a professorial lecturer in law at the George Washington University Law School. Hughes and co-authors published a paper in the November 2024 issue of Health Affairs examining the time gap between ACIP recommendations and state adoption of school entry requirements. We'll discuss their findings in today's episode. Mr. Hughes, welcome to the program.
Thanks, Alan. Thanks so much for having me.
Yeah, I'm looking forward to getting a little deeper into this. Maybe it would be good if you could just start by outlining the chain of events. We know that vaccines exist, but what has to happen in order for it to culminate in a school saying you can't register your child unless you show that they've been vaccinated?
Yeah, so typically the ACIP is going to take a look at the vaccine after it's FDA approved and make a determination as to whether or not it's going to recommend the vaccine. And then the state is really looking for that recommendation as sort of a precursor to its decision to require a vaccine. And then that process varies really tremendously depending on the state. But there are a few basic processes that states tend to go through. One could be the legislature decides whether or not to adopt a requirement. So they would actually pass legislation that would very specifically say this vaccine is required for school entry in the state. In other instances, they have actually delegated that authority to the state health agency, so like the state health department, who could make rules. The department could make rules that required the vaccine for school entry using the authority that the legislature has given to them. And then in some instances, the health department actually has set up the rules in a way that they can simply issue a guidance. They can really more quickly move to say, we're adding this vaccine to the schedule of required vaccines in the state. And so that process, again, really varies tremendously depending on the state.
So we're going to talk a lot about sort of the process. But before we do that, it's probably worth noting these are really important mandates. So can you just say a little bit about why, from a public health perspective, it's important to have school entry mandates?
Yeah, so I think of these as vaccines are a broad-based public health intervention, right? They have to be deployed broadly if we want them to really work the way they're supposed to work. And by working the way they're supposed to work, we mean achieving herd immunity, widespread coverage in the general population. And so how do we really accomplish that? We need laws that can really reach the entire population. And I really think something that's important to note is early on, we first thought about these requirements as containing outbreaks. But over time, as we've seen this ability to give vaccines and to give more vaccines to prevent outbreaks from happening in the first place, so to really suppress endemic disease, they've become a really important tool for public health.
Yeah. So again, we're not going to speak so much in this conversation about the health implications, but suffice it to say, these are a critical tool in fighting preventable diseases. So, whenever one level of government or one agency has to rely on another, you ask the question, does the one that took the first look think about these issues the same way or consider the matter the same way that the later one does? Because if you want to rely on someone, you need to know what they're looking at. So maybe since the first link in the chain here is the ACIP recommendation, can you say a little bit about what it is the ACIP is looking for when they decide, okay, this is a vaccine we're going to put on the recommended schedule?
Sure, sure. So, of course, the FDA has already looked at the safety and the efficacy of the vaccine before it comes to the ACIP, but they typically take another look at that safety and efficacy data. And then on top of that, they're going to look at a number of additional factors because they're recommending the vaccine for use in the United States, and they need to think about how it's going to be implemented in clinical practice. Is it feasible to implement in clinical practice? They need to think about the setting of care, the population to whom it's going to be administered. Any considerations around specific age groups, specific risk factors. They're going to look at health economics, and they're really going to look holistically at all those factors and decide whether or not to recommend the vaccine.
Okay, so it goes well beyond sort of the original FDA approval process.
Yes.
Well, let's get into what you found. You're looking at sort of the time lag. You get this ACIP recommendation, and then you get the school entry mandate. So just set the stage a little for your research. You focused on a few particular vaccines, if you could tell us what those are, and then start explaining what you found.
Sure. So we really wanted to understand the amount of time it typically takes states to adopt school entry requirements following an ACIP recommendation. And, we really wanted to use vaccines that are more commonly recommended. And so we looked at meningococcal vaccines, so meningococcal ACWY, so that's 4 different serogroups of meningococcal disease that those vaccines prevent. And we looked at the first and second dose requirements for those vaccines. And then we also looked at Tdap, which is tetanus, diphtheria, and acellular pertussis. And we used those to really drive the whole analysis. So to look at when states had adopted the first and second dose of meningococcal and then the dose of Tdap. And then we looked first at the date of recommendation by the ACIP for those vaccines. And then we went back and looked at a lot of historical records to determine exactly when the state adopted the requirement in their jurisdiction. We measured the length of time between the recommendation and the adoption of the requirement.
And it took a while. What did you find?
Yeah, so it does take a while. We found that on average, it takes states about a decade to implement a requirement following a recommendation for a new vaccine.
That is a long time, given that these have been not just FDA approved, but then they've also been reviewed by an organization whose whole job is to figure out whether it's appropriate to apply these to the population. You did find a little variability. Obviously, those are averages, as you said. Can you just give a sense of, how quick can it be? How slow can it be? And does it differ from vaccine to vaccine?
Yeah, it does. And I would say that, again, it goes back to those state processes. So, states that have the ability to move through rules or through guidance tend to be able to move more quickly. They're more nimble. So this, really goes back to the differences in state processes, right? So as I'd mentioned, some states can implement new requirements through rulemaking or through guidance. And those states were typically looking at, a time period of about 2.8 years or so, somewhere in that area, because they're able to really move more quickly. The health officials in that state were probably, very aware of the new recommendation and wanted to, see it implemented in the state. And so they moved through the process relatively quickly. On the other end of that, we see that it took some states up to 18 years. Some of that would have to do with the length of, the process, the complexity of the process. But some of that would have just been political will or the willingness of public health officials to really go out and pursue the implementation of the requirement. Some of this could be driven by, the concern over the politicization of vaccines. Some of this could be driven by the perception that the disease is not as much of a threat in this particular jurisdiction, as much of a public health concern. So you have some different, motivating factors that are going to impact that. But again, the process, the differences in process are going to add to that variation as well.
Well, I want to explore a little bit more about what we do and don't know about what these state differences are. We'll discuss those topics after we take a short break. And we're back. I'm speaking with Richard Hughes about school entry vaccine mandates and the time lag between the ACIP recommendations being issued and when states actually adopt these mandates. We've had a nice discussion about, first of all, the delays are pretty long, but also all these different factors that could come into play, which makes it a little hard for me to figure out sort of what's really going on here. If we have this body, the ACIP, that's supposed to do this review, and then it goes to this other place, whether it's a legislative body or a regulatory health board. You touched on some of this earlier in the conversation, but I just want to go a little deeper. Like, what kinds of questions might the state be asking that the ACIP isn't asking? Or is it that they have different answers? Or is it just, as you note, a collection of political, you have to sort of pull together enough political will because this is new and it's a mandate and people are nervous about that. I guess I'm trying to figure out sort of the range of process, politics, and substance. And I know there's no simple way to characterize that, but you looked at it much more deeply than I do. So whatever insights you can provide would be great.
Yeah, so it's a great question. States are very different from one another. There's the saying, if you've seen one state, you've seen one state. And I would just say that, there are some states that bring a level of sophistication to this process. They often will actually replicate the work that ACIP does at the state level. So they'll have a group of local experts, mostly physicians across the state, who are very familiar with clinical practice in the state. They're very familiar with the patient population, and they're going to have a pretty thoughtful conversation about the evidence that exists, whether it's appropriate to give the vaccine, or to require the vaccine in the state. And they're going to take into account a lot of, unique considerations specific to that state, including the disease epidemiology in the state, whether they feel it is appropriate based on all of those factors to require the vaccine in the state. You do have other states where the authority really is left to public health officials who, really have to determine whether they can move forward a policy like this. They have to typically get approval, sometimes all the way up to the governor's office. Or they might be reviewed by a state legislative committee, which we've seen play out in Wisconsin, where a state legislative committee pressured the health department to withdraw a proposed requirement last year. And so there can be some political factors. Also, some states have boards of health. Some states don't have boards of health. And so typically, if there is a board of health, that is an added layer to the process of reviewing the proposed requirement and approving it.
So I guess if I were sitting at the ACIP, I would have a number of reactions to this analysis that you've done. On the one hand, whatever happens at the ACIP sets off a chain of events. And without the recommendations of the ACIP, presumably some of these mandates would never come into play. Or they might, who knows when states would get around to it. On the other hand, I would look at it and say, wow, we do all this work to try to figure out whether or not this is a good idea. And then we're just getting second guessed. Every time we turn around, someone's saying, well, like you just said, some states almost have a mini replication of the process. I think, well, why bother if someone's going to do it? Now, I get the politics. I get that, some things just take time to get through. So I wonder if, and I'm not a clinician here, so I got to be careful how I ask the question. But is there anything based on your examination that you would say to the ACIP, like, if you thought a little differently about your role, or if you went a little deeper in this area or something like that, we might see faster take-up of these, life-saving vaccines?
Sure. So, I think that one view is that we want as much uniformity as possible in this country when it comes to vaccine policy. We want to protect every child that we can protect. If we're going to recommend a vaccine, that we should try to, as uniformly as possible, make that vaccine accessible. That's important to equitable access to vaccines. But we do have a patchwork because, by and large, we have left these kinds of decisions to the states. They have the police powers. They can make these determinations as to whether they're going to adopt these policies in the interest of health and safety. But it is an important consideration for ACIP. And as I said, they consider implementation, feasibility of recommendations. And so I do believe that it is important for ACIP to keep in mind the downstream policy considerations for states, including school entry requirements. There are other areas like immunization information systems, but it's a very important consideration that should be taken into account by ACIP. Something that really interested us in this work is the suggestion that these recommendations should be rolled back. And that's not a decision that I think should be made very lightly. And I think a very important consideration in that discussion is the effort that did go into adopting these requirements. As I've described, these are very cumbersome, sometimes very lengthy processes. It took states, some of them up to almost 18 years. So I don't think we should take very lightly this discussion about going back and reversing recommendations. And that discussion has occurred around meningococcal vaccination, which I think is, really unfortunate to sort of hastily move through a decision like that.
Well, I guess you've captured what always comes out of conversations of federalism, which is a topic near and dear to my heart, having worked at the state level for a long time, which is clinically, there's no reason you would have any difference from state to state. Kids have the same risk factors or close enough to the same risk factors. The vaccines work the same no matter what state you live in. But there is sort of this mythology that if we had uniformity, we'd be uniformly fast. And it might be that we'd be uniformly slow. Or it might be that without the political will of a few states moving forward and seeing that this can be an effective policy, other states wouldn't follow. And so, the heterogeneity can actually lead to better policy development, even as it frustrates those who say, why are they taking so long? But it does also seem like, as you note, the ACIP does more than this, but their awareness of the challenges in translating the recommendations into actual policy would be useful. And I wonder if maybe out of this paper we could encourage them, and if they haven't already done it, forgive me if they have, but maybe they could do a little bit of a listening tour with some states to try to understand how the recommendations are used and how potential changes to their processes would facilitate faster adoption. That might be a way to not change the federalist structure, but to embrace it. Any other thoughts about where you would go next with this analysis? Not just thinking about the ACIP, but also the states. What implications does it lead to for you?
Yeah, so, I think it's really important that we understand the importance of vaccines and continuing to suppress endemic diseases. And if we ultimately want to see elimination of diseases, we have to really persist with these policies. And I think there's a common misconception that, we see it with the flu vaccine, right? People who believe that if you can still get sick with the flu, you don't need to get vaccinated. But it's really about this overall suppression of disease, reduction of disease, morbidity, mortality, severity. And we have to continue to do that until we see elimination. And for smallpox, we saw the last major outbreaks of smallpox in this country in the 1950s. We did not eliminate requirement policies until the 1970s. We still vaccinate against polio today, even though it's so rare. And we need to continue to do that for the diseases today that we've not fully eliminated. And you take a disease like meningococcal, invasive meningococcal disease, very high case fatality rate. And I think one of the reasons that it's being discussed by ACIP right now is the success of vaccines. We've seen drastic reduction in meningococcal disease, but again, it's still a very very concerning threat, public health threat. And I think we should take those things into account when making these decisions, whether it's an ACIP recommendation, whether it is a state level policy like a requirement.
Well, Richard, thank you for having this discussion with me and for shining a light on a critical public health tool that I think everyone knows is out there, but adding this data-based lens to it to understand what's really going on is a great first step in thinking about how we can maximize the public health benefits of vaccines. So thank you for the paper and the conversation. Thanks for being my guest today on A Health Podyssey.
Thanks so much, Alan.
Thanks for listening. If you enjoyed today's episode, I hope you'll tell a friend about A Health